4th of February was World Cancer Day. And why is it important that a day is set aside to, quote-unquote, create awareness? Some would think, is it celebrating cancer? But it's cancer awareness, and it's important because early detection saves lives. Cancer organizations and media partners often work together to create public service announcements, to educate people, and to ensure that people get checked to prevent cancer and to ensure early detection. Now, today on the show, we're joined by Aspire Coronation Trust, Aspire Foundation, a grant-making non-profit organization established in 2016 to support local, national, and regional non-profit organizations working to address challenges and associated vulnerabilities across the African continent.
Now, join us this morning to discuss this very important conversation. We are joined by Abiodun Owo, Program Manager, Aspire Foundation, Dr. Adaorah Enyi, Director of Research and Innovation at Sebeccly Cancer Care and Support Center. We also have Mrs. Mojisola Animashaun, CEO, Cyril Foundation. A warm welcome to you both, and to Abiodun joining us virtually.
Thank you for having us.
Now, I'd like to start with you, Dr. Enyi. What are cancer celebrations? Why are cancer celebrations significant? And what key message should we take away from this year? And like Olive said, so why do you call a celebration when it's not a very good thing?
Yeah, so I think World Cancer Day celebration is more than just a date on the calendar. I think it's an important day that is being set aside to celebrate and remember those that are being impacted by cancer. Understanding that cancer is not just a disease, but it's a disease that actually affects and changes the lives of people who are affected by it and people who have loved ones and relatives that are affected by cancer. And so World Cancer Day is really set aside to create awareness. This year's theme, United by Unique, shares more light on the lived experiences and stories of people who have gone through these debilitating conditions to see how we can begin to pull resources together to support them.
All right. I mean, I think these are very important points to highlight when talking about cancer. Cancer is, oftentimes when you ask people, what's the one sickness that if you had a superpower to cure, what will it be? Everybody always, most times, echo cancer, you know. And Dr. Mojisola, you, of course, ensure that with the work that you've done from prevention to, from diagnosis or prevention, diagnosis, treatment, and even aftercare of cancer, I think it's also important for us to know how far we've come. So in terms of treatment options, how have these evolved for cancer, for the treatment of cancer?
Both locally and internationally, the care of cancer has evolved very much over the years. In the last 2-3 decades, there have been a lot of innovations in treatment of cancer, how they're treated, how early they're treated, and all these things have improved the chances of the patient staying alive. So there have been things like even the regular treatments like radiotherapy, surgery, which are the first go-to things, and chemotherapy. You also, all those have been improved in the kind of drugs they use. The drugs are more targeted to particular tumors. A lot of work has been done in research, in cancer research over the years, and that has shown that in many countries, especially including Nigeria, that the outcome we're getting it, even though the centers are not available. We don't have enough centers, but we're still struggling with the ones that we have to ensure that we get the best quality care for the patients when they come for treatment.
I think another thing, you know, that I'd like us to maybe highlight would be like the most common kinds of cancers. I mean, in the course of your experience, let's speak with Dr. Enyi. In the course of your experience, you've been doing a lot of work with cancer. What would you say are the most common forms of cancer? Oftentimes we hear breast cancer. Also for men, you know, what kind of cancers do we see in men? And I'd like you, as you're talking about these cancers, let's talk about the barriers that are ensuring the progress we're making in the fight against cancers. Barriers being religious, cultural, social, economic, you know, whatever these barriers are.
Okay, so, I mean, cancer is not gender specific, but unfortunately, in Nigeria particularly, the top 2 cancers that affect people are breast and cervical cancer, so it affects women. So women have been disproportionately affected by cancer, and then for the men will be prostate cancer. And now we are seeing more of lung and colorectal cancer affecting both genders, or whatever gender you choose to identify as. But some of the challenges, that are being posed, one, of course, is the stigma. There's a lot of stigma. For many people, cancer is a death sentence. When you get that diagnosis, cancer, when you hear it, there's that God forbid mentality, right? So many people already believe that once you have cancer, you're going to die. So that stigma also contributes to a lot of late presentation that we see in the hospital. I think a second thing too is that many patients, when they get the cancer diagnosis, they run from pillar to post. So you see them leverage a lot of religious, traditional, unorthodox kind of care before eventually coming into the hospital, right? And then thirdly would be that even we as a community, we're not really supportive of people. We're not disrupting or debunking some of these myths associated with cancer, right? We are not supportive of people associated with cancer. And I'll give you an example. A woman has a breast cancer case, right? She has been diagnosed with breast cancer, and you hear things like, oh, my husband said I should not get treatment, right? And you wonder, right, if your husband says you should not get treatment, then, I mean, you definitely don't want to create some family rift around that. Also, there's also this belief that when you have, for instance, breast cancer, and you have to take out the breast, right, you lose your identity, right? And a lot of women feel that way, that they lose their identity. And so you see a lot of women wanting to shy away from doing mastectomies or doing anything that would take off their breast and take off that identity. So these are some of the many, issues. Then, of course, we know that cancer care is financially toxic.
Absolutely.
I always tell people that you're one cancer sickness away from poverty, right?
So that is for those who are financially stable.
Those who are financially, I mean, the average cost of cancer treatment ranges between millions of naira, we'll say like 5 to about 10 million, when you look at from surgery to chemotherapy, targeted therapy, radiotherapy, and then supportive care. So cancer care is financially toxic, and these are some of the challenges that we have to face when managing patients with cancer.
Thank you, Dr. Enyi. I'd like to bring Abiodun Owo, Program Manager, ACT Foundation, into this conversation. He's joining virtually. Good morning, Abiodun.
Good morning.
Now, could you tell us how your organization is working to provide treatment and support to patients, especially those in underserved communities? Dr. Enyi here just told us how expensive and financially debilitated cancer can be.
Okay, thank you very much for that. So at Aspire Coronation Trust Foundation, what we do is to leverage partnerships, leverage relationships so that we can create social impact solutions across Africa, and that includes cancer care. So with partners such as Sebeccly Cancer Care, with partners like St. Cyril, and many others across Nigeria and across Africa, what we do is prioritize those who work in underserved communities. So you have the likes of Pink Blue, for example, who are far away in FCT in Abuja, working in remote communities. You have Dope Haven working in Kwara State in the remote communities, and who are also prioritizing people at risk, women, men, and also young girls now coming down with cancer. So what do? We invest in preventive care, for example. So you have education going on in communities, screening efforts going on in communities, because prevention, they say, is always better than cure. And in this case, less expensive than curing. So at that level, we prevent cancers in the first place. And then when there are cancer cases, depending on the stages, some of our partners also provide navigation services like access to medical care, access to counseling and psychosocial support and things like that. And when they cannot handle such, there's also opportunities for referral services, which is what we do at Aspire Coronation Trust Foundation. So as we do not intervene directly, we have the funds, but then they have the expertise, they have the human resources, they have the partnerships that they have created in the communities, and we work together to create these solutions together.
All right, I still want us to talk a little bit about funding and talk about maybe the innovative ways. Are there some innovative measures that can be approached to ensure that we can guarantee sustainability in funding of cancer programs?
Okay, thank you very much for that. So because cancer care can be pretty expensive, like Dr. Adaorah had established, we cannot rule out partnerships. We cannot rule out collaborations in cancer care. So governments, we have established that they can't do it alone. Private organizations also cannot do it alone. Funders cannot do it alone. So what do we need? We need public-private partnerships. Can you have organizations, private sector players who can, for example, bring in equipment into the country? Can we have maybe like tax leaves or reduced levies on cancer drugs, on cancer products, on cancer gadgets, for example? Cancer insurance especially is another model I think that we can explore. So you have even organizations that have HMOs, you find some of them are limited only to screening and maybe some level of care, or maybe vaccination. Can we also expand access, through those HMOs? Can they also provide comprehensive care to cancer in their plans? So public and private partnership is one thing that we need to continue to work on. We can also work on reducing the tax levies on cancer drugs, because that is a contributor to why they're so expensive. I think another way to do that is to also promote local production of cancer drugs, for example. Is that something we can explore here? So that we don't have to deal with importation and then cancer drugs are reduced. Besides that, I also think that our government also needs to take responsibility. They need to also intensify cancer care programs in the country. Yeah, we have the likes of youth that have a cancer treatment center. I'm not sure we have up to 12 of such in the whole of Nigeria, and we need a whole lot more, because we have millions and millions of people coming down with cancers who cannot afford this care. And when you have public-private partnerships, it gives room also for subsidized treatments. So it doesn't become as expensive as it would be normally. We have such going on in Nigeria, and I think we need a lot more of that in order to finance cancer care.
Sure.
Definitely a lot more needs to be done, and we're just scratching the surface, barely scratching the surface.
I like the holistic answer she gave, but I think particularly I've always wondered why. I think it makes sense why the hospitals will want to not include cancer in the HMO, but on the part of the individual who's paying the insurance, it just sounds like very unfair.
Yes. Now I want to bring Mrs. Mojisola Animashaun back into this conversation. There's a ignorant misconception on the part of quite a number of people. They feel, cancer is a rich man's disease, they say, or we normally deal with, or a white man's disease, that we deal with malaria, typhoid, what have you. What has been done to deal with this misconception? And also, people would like to know, one of the frequently asked questions when it comes to cancer is it hereditary? Are there things you need to do, lifestyle choices you need to change to avoid cancer?
Yes, the first question is about, is it a rich man's disease? Unfortunately, just like Dr. Adaorah said, it doesn't respect gender or your financial status. So it affects everybody across the board, depending on what's age, more age or gender rather than economic status. And the difference in that is in the detection, the early treatment, the creating awareness. So where we're trying to close that gap is ensuring that both the rich and the not so rich are aware of what to look out for, know how to do the breast examination, know how to go to the doctors. And there's still a lot of awareness that needs to be created, but the NGOs are doing a huge amount of work in ensuring that people go to the doctor early, go to the primary health center early, go to the general hospital early, scale up and informing people, empowering people by informing them, from the market women through to the people in the schools, the teachers. So everybody is having more of an idea about cancer now, rather than in whatever language you're going to say it, rather than it was before. And in terms of
if it's hereditary,
being a hereditary, there are some cancers that are hereditary, but most of the time the cancer just appears, and there's some that can be called familial. Hereditary usually like childhood cancers, they can be hereditary, but you also have the ones that are familiar. Breast cancer, for instance, it's not hereditary, it's not passed down from one to the other, but if a member of your family has it, it's best to ensure that you go and get screened earlier than those whose family members don't have it.
So what do you mean by childhood cancers, just to highlight what that
cancers
means?
that affect children?
Sorry?
You know, when you said childhood cancers are hereditary, I wanted you to throw some more light.
Yes, you can have some childhood cancers that you can actually, I think Wilms tumor is one of those that you can get. It's if one member of your family has it, then it's more likely that another person within the family can inherit that. But it's not actually. Looking at, we don't have statistics. I mean, data is very, very poor in Nigeria, unfortunately. So we don't have enough data to be able to follow this through in our country, but in other places you can actually follow through and see which ones are particular to all right.
Okay.
Different part of
I
the
want
world.
to still talking about this misconceptions and myths that we have. Dr. Enyi, if you go through social media, I guess it depends on your algorithms and the feeds you follow, but there's a lot of scaremongering. There's, if you microwave meals, you're susceptible to cancer. In my mom's house, she doesn't
use microwave.
Have a microwave.
For those of us that like to do gel polish, they say put your hand under the UV machine. We have cancer.
Non-stick pans. I mean, it's almost like I should go fry my eggs.
If you deep bread, cancer. It's almost like what can we not do? Or what can we do?
Fatty things.
I mean, yes, there's a lot of myths. For one is, I think one common myth that I hear a lot, which from women, is that don't even wear bras with iron. Right, it would introduce cancer, underwire bras, right? Don't microwave your food, right? Unfortunately, the type of radiation that comes from microwave is non-ionizing, right? So it does not,
doesn't cause cancer.
It does not, there's no scientific evidence that the type of radiation caused in microwave is non-ionizing, so it doesn't, it has no direct link.
I hope my family members are watching.
It's only ionizing radiation.
So it's only ionizing radiation. Then you hear things like, large intakes of sugar, right? Sugar fuels cancer, right? And that's absolutely incorrect, right? There's no evidence to show that. There's just 1,000,001 myths associated with cancer.
What of those of us that use gel polish?
Well, so unfortunately, it doesn't directly cause cancer, but of course, the light from the machine can actually destroy the skin beds around there, but not causing cancer, right?
Like me, go natural.
Right, but not causing cancer. But just to speak more about cancer in general, in terms of prevention, in terms of screening, early detection, treatment, and supportive
actions
care
that predispose people to cancer.
Yeah. So I think the first thing is a lot of work has been done in terms of education. So the first thing is you need to even be aware and accept that cancer does exist, because there's still a lot of us in this 21st century that don't think that word cancer exists, that believe that cancer is only for some certain group of people. And just as Mrs. Moji has debunked today, it is not a respecter of gender, it is not a respecter of age. And so it's important that everyone knows that cancer exists. It's also important that you begin to identify some symptoms. If you see suspicious symptoms, if you see a nipple discharge, if you touch your breast and you feel a lump in your breast, you should take action. If you see that you are spotting when you are not supposed to be menstruating, you should take action, right? If you're having difficulty urinating like our men, or you seem to be having pain during sexual intercourse, you should take action, right? It's very, very important. And I always tell people that it's unethical for you to pride yourself that in the last 10 years, in the last 5 years, you've never visited a hospital. And I tell you that the moment you are seeing me, it's always very, very bad, because then you're spending millions for something that you could have used 30, 40, 50,000 naira, to present if you had just done your screening.
Early detection.
And so I say, for those that you pay for health insurance, you have your HMO plan, why are you keeping money on the table, right? Why are you not doing your health screening, your cancer screening as part of your screening every year? Every year, every woman, if you know that your next birthday is your 40th birthday, or you know that you're already 40, you should have a mammogram done. If you're a woman that is sexually active, you should have a pap smear done, right? And if you're a man that is also at the age of 40 or above 40, you should get your prostate glands checked. You should do a PSA test, right? Every year, you should try to do this test just to check. And of course, if you're above the age of 45, get a colonoscopy done. Let's check for colorectal cancer before it becomes too expensive for us to manage.
I mean, I think in the course of this job as well, being able to interview a number of people, I found that cervical cancer is one of the cancer that presents pre-cancer cells.
Yes,
so
pre-cancerous. Yes.
And what that means is if you check early you would never get there.
Absolutely.
So I'm hoping that with these few points of ours, we've been able to convince and not confuse you about early detection. And let's bring in Abiodun as well, who's joining us virtually. Talk to us about some of the biggest stumbling blocks that ACT Foundation has faced in this journey. I know you've mentioned funding and the ways in which people can come in and the ways we can navigate that. But what are some of the other challenges that ACT Foundation has faced in the course of doing this great work? And how can, individuals, businesses, organizations be a part of what you do?
Okay, thank you very much. So I guess I'll bring it back to funding really, because we would really like to do a lot more than we're doing now. And so what our partners are doing is chiefly preventive measures, training health professionals, for example, because in Nigeria, oncologists, how many of them do we have? We don't have up to 100 in Nigeria. Yet we need a lot more than, a lot have jackpot, and then our institutions are not churning out as much as are necessary, So this is also a huge challenge, because when the funding is there and then you do not have health professionals who can meet the community members at the point of their need, then there's a problem. So it still boils down to resources. So monetary resources is something, human resources is also another, because for cancer treatment to actually be complete, they need health professionals to be around on ground when people need care and support. So really, I'll bring it back to funding, because we really would like to do a lot more than we're doing right now. And then access to funding is something that we need to keep increasing so that we can reach, the last miles, the people in the remote areas who actually do need this support. And
so how can they reach out to you if they need to contact ACT Foundation, and they want to support in way of funding? Are you also open to accepting volunteers? How can they reach out to ACT Foundation?
Yeah, so we have our social media handles on Instagram, we're ACT Foundation _. We are also on Facebook as Aspire Coronation Trust Foundation. Our website is www.actrustfoundation.org. We're also on YouTube. You can reach out to us on Twitter, also ACT Foundation _. Thank you.
Thank you very much, Abiodun. Just before we wrap up, I would like to take your final thoughts in 30 seconds. Looking ahead, what needs to be done to reduce the cancer burden in Nigeria and Africa?
Well, we need to continue to increase the awareness that's going on right now. And the government, it cannot be done without the government. The government has to make an enabling an atmosphere for people to be able to donate, even for instance, donating to ACT Foundation. Give a tax break to corporates to be able to do that, and encourage people to be able to put good money down to ensure that people are treated early.
Thank you very much. Dr. Adaorah, she ate into your 30 seconds, so you have 20 seconds.
So just as Ms. Moji has said, I think collaboration, the power of collaboration, it cannot be underestimated, right? There's need for more financing and funding in cancer care. There's need for more training of, oncologists and cancer specialists to support the already depleted demand.
All right, Dr. Adaorah Enyi, thank you very much. Mrs. Mojisola Animashaun and Abiodun Owo, thank you very much, ACT Foundation, for the work you're doing. And we look forward to seeing more in the fight against cancer. And this is where we'll wrap up this conversation. We'll go on a break. And when we come back, we have more. Stay with us.